Moving on now to another very, very interesting topic, which a lot of women have messaged about, is pigmentation. It's again very wide, very vast.
More minutes. I'm in the clinic, if you see, and because of
Yes,
times, we have taken patients literally by the hour and by the clock. Um,
yes.
so they
So
come
we
on.
can make this the last question then. You can speak about pigmentation and let us know what we can do for that.
Perfect. So pigmentation could be again like an acne. Varied reasons to pigmentation. Small things I can say what you should do and shouldn't do. Let's stick to that pattern. So what you should do is one, um, meet your doctor. So she will tell you what the pigmentation is due to. It could be a simple tan. It could be pigmentation because you have rubbed yourself too hard. So friction
Hmm.
melanosis is what we call it. It could be that. We call it as Riles melanosis when it could be just a wrong product used for a wrong time. It could be that. It could be autoimmune conditions where your body behaves badly to your own skin, which could be because sometimes because of thyroid that can happen. So that can be affecting and making your skin look dark. It could be something called as LPP, what we call an inflammatory condition that could happen. You could have simply like a cloasma or a melasma, which is hormone derived, which happens on the cheek for most patients. Could be physiological, like pregnancy, which can lead to that. So all
Hmm.
of these could be. Depending on why your pigmentation is, your doctor will then choose the line of treatment. Therefore, it's important for you to go to the doctor to see the line of treatment is right, so you get your results. What you should not be doing definitely is rubbing your skin thinking it is dirt. I see a lot of patients doing that. They use a loofah, they use some sort of a stone, they use some sort of hand gloves and rub them all. That only increases and makes the pigmentation worse. Um, what you should not be doing also is, again, over the counter skin lightening creams, because a whole load of them contain steroids in them and you won't even know. In between,
Okay.
in India, two countries, there was this cream in a box that was floating with a lot of friendly neighborhood aunties with no
Hmm.
label, no nothing, gave magic results to people, and then we analyzed that there was steroids in it. Gave serious side effects to
Hmm.
people after. So very important for you to not to pick over-the-counter products, label-less products. When you don't know what the ingredient is, no matter if it has worked magic on your neighbor or your friend, you don't use it. Do not rub and scrub, like I said, and don't sign up for treatments where you haven't met your dermatologist. Like there are a lot of skincare clinics now,
Hmm.
operated by non-doctors or not enough qualified people. So please make sure you go to someone more responsible, qualified. That is what you need to be looking at when you go for such treatments, and not bargains and packages.
Right. I think the most important thing you said was to not use a product without a label and just because it's worked on someone, because if it's too good to be true, then there's probably something wrong with the product, right?
Some
Okay.
ingredients to look at, so it's useful for people who are listening. Niacinamide, one of my favorite ingredients for pigmentation. Vitamin C, fantastic ingredient without giving you any complications or long-term side effects. You can look for kojic acid. You can look for azelaic acid, even safe during pregnancy. What else can you look for? Any AHA you can look for. Again, that really helps. All of your fruit acids can really help. Berry extracts helps. Your green tea, matcha extracts, all of this help because all of these are antioxidants. So these really help.